Hi, I'm Dr. Danny Ritchie, and
You have the handwriting of a doctor.
well, I squeezed it in. I was like, I better identify myself because I'm speaking here as a physician, right? I'm a clinical assistant professor of family medicine at Brown, and I teach about policy, culture, and discourse and how it shapes health and healthcare. And I'm here to oppose 8310. When I talk about discourse, let's really think about how our culture and our discourse continues to take us to the same place around safety. But let's talk about safety in terms of nourishing and caring environments. How do we create a nourishing and caring environment in our school systems for our children to grow up in? Right? We forget that, and I would promote the PASS plan for you to read it because it talks about an alternative so that we can switch our language. We have to switch our language. We have to switch our thinking about what creates safe environments for our children. I'd also like to talk about the harm. We hear so much, so I'm not going to regurgitate a lot of the issues around the harm, but this is traumatizing to kids. We don't just have to hear about guns, right? They get pepper sprayed, they get injured, they get tased. This happens to Rhode Island students, black and brown. So we've heard about a case this year of a Providence student who was injured and held in prison for days, for hours before his parent was contacted. People haven't talked about the South Kingston incident of a student that had 1,700 signatures of parents protesting when they found out that their child had the knee, had a knee on the neck by the SRO for discipline. So let's not continue to create unsafe, unnourishing environments for our children. Let's support them and make nourishing and caring environments for them to learn and grow in. Thank you.
Thank you very much. Yes, ma'am. You're on.